Hello, everyone, and welcome to the PAPERI Bright Mind Series, held in recognition of International Childhood Cancer Day, ICCD 2026. This series brings together voices from different disciplines and regions to highlight how research, clinical practice, and health systems can work together to improve outcomes for children with cancer. Today, we are honored to be joined by Dr. Juan Carlos Nunez. Dr. Juan is the head of the Health Research Division at the Pediatric Hospital of the National Medical Center Siglo 21, known as IMSS, Mexico's largest public healthcare institution. A pediatrician scientist with 105 peer-reviewed publications in indexed journals. He also serves as a reviewer for leading international scientific journals. His work focuses on childhood cancer and leukemia in Mexico, including geographic accessibility care and other determinants that shape outcomes in vulnerable populations. He has mentored trainees across specialty, master's, and doctoral levels, and has been recently recognized with IMSS Excellence in Research Award. Internationally, he is part of the Inter-Academy Partnerships Young Physician Leaders Program, serving on its Omni Steering Committee, and is a member of the Childhood Cancer and Leukemia International Consortium known as CLEC. We are very grateful to have his perspective as part of ICCD 2026. Dr. Juan, thank you very much for joining us today.
Dear Dr. Guafa and people, thank you for this opportunity to present one of my passions in the life, which is the research of childhood cancer and childhood leukemia um, etiology research.
Thank you. And let's start with your work. From your perspective, what are the important advances in childhood leukemia research or care currently shaping outcomes in Mexico?
I think two advances are changing outcomes in our country. First of all, a more precise diagnostics and risk-adapted therapy. And second, a stronger supportive care and infection control. And on the research side, we are moving beyond biology alone and measuring real drivers like treatment abandonment, poverty, distance to care, and research on environmental causes of childhood cancer, particularly in populations where poverty and healthcare access is very problematic indeed.
Okay, this is very clear. This is very good. So, how does your work within IMSS and national research programs influence real-world pediatric oncology practice?
Yes, in 2021, national program and focused on childhood leukemia, environmental causes, attending also the technology access to the underserved population. It was a very it was very challenging, but also it was successful until date because the mortality during the first year of diagnosis was lower after we can implement the access to, for example, an extended immunophenotyping and also to molecular tests in population of the south of the country where poverty is high. But in the other hand, my institution, the Mexican Institute of Social Security, is the largest public health system in who attend patients with cancer, and we can test solutions at a scale. Our national programs, for example, help connect hospitals, harmonize data, and turn findings into actionable changes like referral pathways, adherence strategies, and better monitoring of outcomes.
So there was a national call in 2021 focused mainly on
On childhood
childhood cancer,
leukemia.
leukemia,
Childhood leukemia, yes,
leukemia.
because
Okay.
it's the childhood leukemia in our country, as in a lot of countries in the world, is the main type of cancer in children, pediatric age. But also we have um, high mortality rates,
Yeah.
mainly in the south part of Mexico. For example, states like Chiapas, Oaxaca, Puebla, Tlaxcala, and where also coincides with environmental hazards, polluted rivers, a high use, for example, of pesticides, uh, fertilizers, and so on.
Okay. So what are the key challenges facing childhood cancer research and care in Mexico today, particularly in vulnerable or underserved populations?
We still face fragmentation across regions. I think it is one of the most important challenges. Limited resources in supportive care and gaps in timely diagnostics. But the biggest inequity is access, I think, who can reach care, stay on treatment, and complete therapy without catastrophic burden. And moreover, high incidence and mortality rates in southern Mexico, which correlate with high poverty rates, is a challenge we must attend in the next years.
So let me ask you a question related to the system perspective. Are there examples where research evidence has successfully informed policy or system level change?
Yes, it exists, but the cover, for example, of treatment is not reachable today. In the Mexican Institute of Social Security, yes, it is covered, but it attends 55% of the whole population of Mexico, and the remaining 45 or 40% are attended but not covered the treatment of cancer in children and adolescents until date.
So there is inequity to access care.
Yeah,
Oh,
yeah.
okay. So in let me move to another question related to global collaboration. How has being part of CLIC strengthened childhood cancer research or collaboration in Mexico?
Yes, Click gives us a trusted network to share methods, compare data, and learn what works in other settings. It strengthens also our capacity in study design, benchmarking, and collaboration. So Mexico contributes evidence and also benefits from this global expertise.
So is there a paper published by CLIC or do you contributed or led a research study with CLIC? Actually, I can't remember, but you actually remember.
Yes.
Uh, uh,
Yes, we are contributed particularly in smoking
Smoking.
exposure, also in myeloid leukemia, for example, with Catherine Metayer, and with Jeremy Schrock, for example, in the infant formula feeding. We
Yes.
also contribute, and we have proposed some pooled analysis related to parental occupation exposures in
Very
infants
important.
and also infections
Yeah.
associated with a higher risk of childhood leukemia. Juan Manuel Mejia, who is the PI of Mexico representation, and myself have presented this pooled analysis, and in the next year we will present the results.
Yeah, very good. Many people published, and there are contribution and papers appeared in.
Yeah.
Yeah, it's very good. So, what do you see as the most valuable role of international consortia in closing survival gaps globally?
The most valuable, I think, role in reducing inequality through shared knowledge about environmental hazards is that they can be preventable.
Ah,
If we don't have a disease, uh, we we were capable to reduce survival. No, so a child's health doesn't depend on geography, I think, and consortia also support capacity building, training, harmonized data,
yes,
as I
you're
mentioned
right.
before, and implementation research also, which is important. No, it's important to apply what has been working in other countries and
Yeah,
bring to the more affected populations for different reasons. For example, the access of care, as I mentioned before, when we work together with Dr. Rosana Pelayo and the Cytomics Laboratory in Puebla, they provide to the to the doctors, to the medical doctors, and the pediatric oncologists, dermatologists, the result of immunophenotyping classification in no more than 72 hours. When historically they received this result, for example, in 12 days, which affects, of course, the precision medicine, but the timely
yes,
opportunity, the timely diagnosis and treatment for these children, and this strategy as part of the national program I commented minutes in previous minutes, change the mortality, low the mortality rates for in the first year of treatment, where also in previous studies we have demonstrated that they are very high in our country, particularly in southern Mexico.
so it's very valuable, and you encourage all who listen to us to put in to go in collaboration and be and
Yeah.
sharing data in consortium, especially focus on pediatric oncology. This will help and very valuable to close survival gaps and to increase help to progress knowledge and advance research together. So, as we
Yes.
mark International Childhood Cancer Day 2026, I would like to ask, what's one priority action you believe could make a meaningful difference for children with cancer, either in your country, Mexico, or globally?
I think we are still on the invest in health system solutions. Biology matters, but survival gaps are often driven by access, delays,
Yeah.
and continuity of care. The priority is to treat the system as part of the cure. But on the other hand, on the way of childhood cancer prevention, by generating solid scientific evidence for guiding health public policies.
Yeah. So, what message would you share with early career researchers or clinicians working in childhood cancer in low and middle income settings?
This question really excites to me because I incorporate to the click in my early career years, and of course I have learned about a lot of all the
Yeah.
researchers of click, such as you, of course. And I think that the message for these early career researchers or clinicians in low and middle income in countries is your work is essential. Focus
Yes.
on high impact questions, research questions. For example, uh, causes of the disease. I think prevention we is mandatory right now. uh, Questions about access, quality access, adherence, and use data to advocate for change, collaborate early, and publish rigorously, and never underestimate the value of implementation research. That would be my
Very
message.
valuable. Very
Yeah.
valuable advice. Yeah, thank you so much. So, on International Childhood Cancer Day, what gives you hope for the future of childhood cancer care? So, let me say what you make you go and continue in the field with passion.
I'm hopeful because more countries of the global south are recognizing childhood cancer as a health system priority. When we connect science, policy, and frontline care, outcomes change. As in Mexico, we have experience, as I commented before, in this national program. And the momentum for collaboration is, um, and the momentum for collaboration, I think, is stronger than ever.
Yeah, this was my last question, and thank you very much, Dr. Juan, for sharing your insights and experience with us today. Your reflection highlights the importance of many aspects of childhood cancer, improving outcomes for children with cancer. We are very grateful for your contribution to the PAPERI Bright Mind series and to the global effort, really, to improve childhood cancer care. This conversation is part of the PAPERI Bright Mind series for International Childhood Cancer Day 2026. Thank you for watching, and we hope these discussions inspire continued collaboration and action for children with cancer worldwide. Thank you so much. If you have any last question you want to say, please let me know.
Just thank you very much for the invitation, the Dr. Wafa, and all the success for all the researchers in the world.
Thank you so much, and have a nice day. Bye.
Have a nice day. Bye.